Have you ever heard of my
No, I just came to do today.
First time we are hearing about it. Okay, this is our sponsor. You can try it.
colleagues and all of you who have taken your valuable time out to come here and join us. I am Dr. Majumder. I am the Director and Head of Nephrology at AMRI Hospital. And today, maybe I'll just speak a few words about how to take care of your kidneys. You know, because that is such a valuable organ. Kidneys do. Whenever we eat any food, that from the food we get energy, but at the same time, waste products are produced from the food. And every day, those waste products must be rid from the body. If they accumulate in the body, then they will cause all sorts of deleterious side effects. And also, they maintain various, the fluid balance. You know, just now we might drink 10 liters of water, but immediately in the next 1 hour, the kidney will get rid of all the water, and then it will come to a balance. But if our kidneys are not working, then this water will accumulate in the body, it will go to the lung, and then it will make us short of breath. So that is very vital, and it also maintains the balance of all the electrolytes, like sodium, potassium, important electrolytes in the body. Now besides this, we are often not aware there are some extra functions of the kidney, like producing a hormone called erythropoietin. Now that is responsible for producing hemoglobin in the body, and not so that we don't become anemic and we get energy. As you know that hemoglobin carries oxygen to all the tissues, so it's very vital. And also it activates vitamin D, which is very important for our bones. So when a kidney fails, you know, all these problems happen to the patient. Now, obviously, you'd like to know that what are the causes of kidney disease. The commonest cause is high blood sugar and high blood pressure. Of course, there are diseases of the kidneys called nephritis, or sometimes we may unknowingly have some painkiller. Or we go to the shop, we got a headache, we ask the pharmacist to give us a painkiller, and that painkiller may cause interstitial nephritis, something which can cause the damage to the kidney, and in the long run it can go into kidney failure. Some places, particularly hilly areas, you know, kidney stones are common, and this may often lead to infections in the kidney. And infections, if it goes up to the kidney, it can damage the kidneys. Often male patients, when they're 50 plus age, they have problems with passing urine, and that may be due to prostate gland hypertrophy, the growth of the prostate gland. There may be certain tumors in the kidney as well, and rarely, sometimes diseases of the kidneys may be inherited from father and mother and from generations also. So these are the various ways the kidney may get affected, and this makes 10% of the adult population, quite a sizable number, about 10% of the adult population suffers for some type of kidney disease. And millions every day die from these complications. And we know that when the kidney becomes terminal, that it's not working, the treatment like dialysis and transplantation, they are very costly and very few people can afford it. And of course, once the chronic kidney disease develops, you know, there are few drugs, but there are very little we can do to prevent the progression. It keeps progressing. And so, one thing everyone asks me, okay, what are the symptoms? You know, how will I know that my kidney is getting affected? Now, unfortunately, very often we don't get pain, because like we know that in a heart attack or heart disease, patient gets pain and he himself goes to the doctor, and we don't have to, you know, convince him to go to the doctor. But often kidney disease, except kidney stone or infection, doesn't cause any pain, and the early symptoms are very subtle. So patients often don't get to know till the kidney disease is quite advanced that their kidney is affected. But early symptoms like swelling of the ankles, puffy eyelids when we wake up in the morning, nausea and vomiting, shortness of breath. Like I said, the water accumulates in the lung and you get breathless when you walk a few steps. pain in the back, in the flanks where the kidneys are, red or Coca-Cola colored urine or frothing urine. When we pass urine in a commode, there is frothing of the urine. So these may be some of the signs that kidney is getting affected by some disease. And the important thing to stress here, that early detection, if we can detect it early, then there is treatment and we can make the kidneys better, and so that it doesn't go into kidney failure. Now, as I mentioned, who are the common people? Now, you might ask that, am I at risk of developing kidney disease? Well, if you have high blood pressure or high blood sugar, now this must often be checked regularly because you may not get symptoms from it, but you are 50 plus, then every 6 months it's better to get a health checkup, get these blood tests done so that you pick up if you have high blood sugar. And if there is a family history, someone in the family has kidney disease, you have to be more alert. Patients who are overweight and of particular some ethnic origins, these people are more prone to kidney disease. Now I'll tell you today 8 golden rules for preventing the kidney disease. These are the things we need to remember in daily life. First of all, keep fit and active. Daily some exercise and moderation in diet. We should not eat too much of protein load at one time. The same day having 6 eggs and also chicken and fish and everything on one day, that is not very good for the kidneys. Keep regular control of the blood sugar level, and the blood sugar level must be kept in tight control, and monitor from time to time. Just go to your doctor, get your blood pressure checked and keep the blood pressure well controlled. Eat healthy and keep your weight in check. As I mentioned, moderation of diet. We shouldn't have excesses in diet. Stay hydrated. Now often people ask me that should I drink 4 liters of water? So just drinking more water is not good for the kidney. You must drink water according to where your workplace is. Someone who's working in the heat, is a construction worker, he will need 4 liters of water. But someone who's doing an office job, working in the AC environment, just 2 liters may be enough. So just drink adequate water, that is enough. Do not smoke. Smoking often has a direct effect on the kidneys. Do not take over-the-counter pills without knowing about it. Like I said, over-the-counter, some antibiotics or some painkillers, that can cause kidney problems and which will slowly progress. And get your kidney function tested if you have one of the risk factors which I mentioned, or if you have one of the symptoms which I mentioned. So just remember these 8 golden rules, and I am sure that you will be able to take care of your kidneys. So wish you happy kidney health. Thank you for coming here.
About the heart is a bit tricky because we have only one heart. And incidentally, most of us would like to keep our heart untouched, But I'm a surgeon, so I have the habit of touching the heart, cutting it, suturing it, so that we can restore the heart to its normal function. So today we'll be talking about the conditions of the heart which will need surgery, which is quite a severe form of treatment for the heart. Sometimes we are not able to prevent it because God give us certain heart diseases which we are born with, and to become normal and to become fit, we must get the heart repaired and reshaped into normal shape and function. Okay. Now, I want to introduce to you the entire hospital team that is toiling 24/7 to take care of our heart patients, and I'm only a member of this team, and Many of our members, they stay back in the intensive care unit at night, monitoring the patients every minute, every second, and taking action when things go even a slightest away from the normal recovery schedule. So you can see the large number of teams, a large number of members that goes into the team that takes care of the patients. We have cardiac surgeons, we have anesthesiologists who are also intensive care specialists, we have cardiologists, and we have a large team of nurses, intensive care technicians, operation room technicians, physiotherapists, and other people who make the hospital stay more comfortable and make it easier to tolerate their pain and discomfort while they have undergone cardiac surgery. Now, looking at the type of heart disease that we are commonly seeing in our day-to-day practice, one is known as congenital heart disease. Congenital heart disease is the type of heart disease that we are born with. A child may be born with a hole in the heart, a child may be born with blue color of the skin and the tongue, and certain other conditions which call for surgical treatment, and medicines are not enough. Second is valvular heart disease. In India, in Nepal, in Bangladesh and in Pakistan and in some of the less developed countries in Asia, there is a common disease which is known as rheumatic fever. Rheumatic fever is actually a fever which is associated with pain in the joints. It starts as a sore throat and then it spreads to the joints and it spreads to the heart if it is not checked properly. And I can assure you that rheumatic heart disease is quite preventable if we can detect it early and treat them. And the commonest valvular heart diseases that we come across arise from rheumatic heart disease. The third common is ischemic heart disease, where blood supply to the heart is reduced. The blood lines, the blood tubes which supply the heart with nutrition and oxygen, they are narrowed because of certain conditions that we'll be talking about later, and sometimes they're so severe that we have to operate to restore the normal function. So these are some diagrammatic representations of heart disease. You can see the holes in the heart, and the red and blue bloods get mixed up, and some of these babies or children, they come with blue color of the skin, and some of them have chronic cough, and we need to close these holes, we need to repair these hearts to give these children normal life to live. So these are, I don't want to go into details of this, but these are complex heart diseases which we do repair regularly and the children become all right. See, this child was blue when this child came to us. We repaired the heart and he has got back his pink color. Coming to heart valve disease. I don't want to go into the details of this, whatever is written there, but one common symptom of heart valve disease is usually it affects middle-aged or younger patients between the age of 20 and 40. Patients complain of frequent attacks of cough and cold and sometimes quite severe respiratory distress. And many of these patients, they will have palpitation, that is rapid beating of the heart. Now, this is another medical term that I don't want to bore you with, but there are certain indications for surgery that we go through before we take up the patients for heart valve surgery. Now, the artificial heart valve is man-made, but it undergoes a long stretch of testing and trials before we can implant it in the heart. See, this is an artificial heart valve of olden days. You can see that ball which is going up and down in the cage with blood flow. And on the left side is a disc like a tube well valve. This disc opens and closes to allow the blood flow in one direction. These are the current models of heart valves that we use. On the left is a heart valve which is made for animal tissues, and on the right is a heart valve which is made for artificial material, biomaterial. The ring is made of Dacron cloth, and the central disc which opens and closes, these are made from pyrolytic carbon. So this is how the valves open and close. We also do a lot of valve repairs because some of the valves are repairable and they stay repaired for a long time if we do a good job and if we can keep the patient in a controlled treatment schedule. So these are the present valves that we commonly use. This is one of the latest valves made from pericardium, which we commonly use in elderly patients. So this is a surgery. You can see on the left side, I've opened the chamber of the heart in which there is a disease valve is seen. And on the right side, an artificial valve has been placed. Now, coming to coronary artery disease. Coronary arteries are very narrow arteries, which often become clogged when there is excessive fat, when there is uncontrolled diabetes, when there is uncontrolled hypertension. Like the arteries of the kidneys, the coronary arteries of the heart also can get blocked. And that is how we do bypass surgery. You can see on the right, there is a blood vessel, blood artery which we have taken down from part of the body and implanted onto the coronary arteries. And there is a vein on the left side which we take from the leg and use as bypass graft. This I'll just skip through. So this is how we use it. Now this is a video of a real-time coronary bypass graft. You can see that. You can see that in front there is a bypass graft, and lower down you can see two veins which are traveling to the left. That is two veins which have been attached to the big artery. They are traveling to the left, going around the heart, and they have been connected to vessels on the other side, on the back side of the heart, which we cannot see from here. So this is a picture of a patient whom I operated 11 years back. You can see the bypass grafts which are functioning. They are carrying blood to the heart and the patient is doing well. You can see the two grafts. One is coming from the artery, the other is from the main artery on the right side, and on the left side is the natural graft which is coming from the artery. So this is how it looks like. So these are various types of techniques that I don't want to go into. We use to supply extra blood to the heart which is suffering from lack of blood supply. These are, I can tell you, cardiac surgery is a highly technologically advanced sort of job. And this is a handle that we use to fix the heart where we operate. This is known as an octopus stabilizer. That is how it is applied on the heart. And when the heart is moving, we just temporarily immobilize a small segment of the heart and operate on that. This is known as beating heart surgery. This is a lady who had a very, very dilated main artery. You can see the main artery arising out of the heart is so dilated. The normal size is where it is turning down on the right side, that is the normal size. On the left side it is so much dilated, it is almost 2.5 times the normal size. And these arteries, they can rupture and cause sudden death. So they need replacement with artificial material. So that is how we operate. We change the heart valve. Now this is one patient which I operated 2 weeks back. You can see the part of the main artery which is coming out of the heart has become dilated like a sac. And his heart valve was leaking and he was having severe respiratory distress. You can see I opened up the main artery, that is a valve on the left, which is very much loose and lax, which cannot hold the blood flow. On the right side, we have cut out that valve, and here we have replaced, and this is the end of the endocardium. After we have replaced the heart valve and that part of the artery which is dilated, and we have reattached the coronary arteries, and the heart looks like this. See, this is the patient, it's a poor patient. He was discharged on the 7th post-operative day. So we were very happy to have a normal recovery, and the patient could be sent back, restored back to his working condition. Now these are all technologically advanced, I should say, tools or gadgets that we use for microsurgery or minimally invasive surgery. We do not cut open the heart, we do not cut open the chest so much. We work inside the chest with small cuts and we complete our job. See, you can see the small cut. In this case, we have replaced the one valve of the patient. You can see on the left side, this is the normal operation, where we open the, say there is almost a 1 foot long incision, a scar. And on the right, there is a small scar, the same operation was done. But this cannot be done in all patients. Patients have to be selected properly to do such operations. You can see on the right side, there is a 2-inch, 3-inch incision. We replace the valve in this patient. And on the left side, there's a normal patient who had a normal cut, and the same operation was done in another patient. I don't think this will be good for your seeing. These are more technological advanced gadgets, tools. We have artificial pumps to replace the heart before we can transplant the heart. So cardiac transplantation is also being done regularly in Kolkata. And these are devices which allow sometimes to keep the patient alive until a suitable transplant is found. Next comes robotic surgery. So the surgeon is sitting here and a robot is working at his instructions. So robotic cardiac surgery is also now being done in many centers, and we are planning to do this also. So this is in short the kind of technological advancements we have been able to make in course of the last 1 decade, that is last 10 years. And presently at AMRI, in the 3 units that we have in Kolkata, we are doing about 250 to 300 cardiac operations every month, and with excellent results. Thank you.
So, यहाँ उपस्थित भई सम्पूर्ण आदरणीय दाजुभाइ दिदीबहिनीहरू, मलाई आज अनएक्सपेक्टेड तरिकाले यहाँको समूहमा आइपुग्दा विश्व बोलाउँदा साह्रै खुसी लाग्यो। हुन त म चाहिँ स्टार हस्पिटलको फाउन्डर बोर्ड डाइरेक्टर हो र जहिले पनि हामी त्यहाँ बोर्डमा आउँदाखेरि कान्तिपुर केटापुरको चाहिँ धेरै टिमहरूसँग मिटिङ गरेर सल्लाह गर्यो, फ्यासिलिटी दिने काम पनि गर्यो र हाम्रो अहिलेसम्मको मेरो नलेजमा किर्तिपुरको साथीभाइहरूसँग दाजुबहिनीहरूसँग हाम्रो असाध्यै राम्रो छ र अझै पनि हामी स्टार हस्पिटल र किर्तिपुरको हामी दाजुभाइहरू मिलेर हामीले एकअर्कालाई कुनै पनि गर्ने सहयोग गऱ्यो भने गर्नुपर्छ भने हामी तयार छौँ। तपाईँहरूको सेवामा तपाईँहरूको गर्ने सुविधा तपाईँहरूको फेसिलिटी दिन हामी तयार छौँ र हामी पछि आउँदा दिनमा पनि अरू कामले गर्न सक्छौँ। स्पेसली हाम्रो बेङ्गलोरबाट आउनुभएको छ हाम्रो डाक्टर साहबहरू AMRI हस्पिटल इज अ भेरी बिग हस्पिटल। Last few months ago, I visited to AMRI hospital. I see all the operation, all the system. I was very happy. Within 1 hour, I got the treatment, I got my medicine, and all facilities very good. That's why if anybody requirement go to Delhi, better go to Kolkata. Why to Kolkata? We are going to jointly doing something. Kolkata AMRI hospital and Vista hospital. So tomorrow morning we have a meeting. How to can develop the treatment system, telemedicine. So, अन्तमा यहाँ बोलाएर 20 बजे बोल्ने मौका दिनुभएकोमा धन्यवाद। थ्याङ्क यू।
आदरणीय व्यक्तित्वहरू, डक्टरहरू, हस्पिटलको सिओ लगायतका हाम्रा अतिथि महानुभावहरू, मिस्टर रूपक, डाक्टर मुखर्जी, डाक्टर मुजुमदार लगायतका अतिथि महानुभावहरू र हाम्रो स्टार हस्पिटलका डाइरेक्टर जीवन भण्डारीजी र हाम्रो अत्यन्त लोकप्रिय र वरिष्ठ हाम्रा सङ्गीतकार कलाकार र सबैले परिचित हाम्रो आनन्द कार्कीजी लगायतका सम्पूर्ण उपस्थित महानुभावहरू सबैलाई नमस्कार। उहाँहरू मैले त कुरा पनि गर्न पाएको छैन, पहिलोपटक आउँदै हुनुहुन्छ वा धेरै पटक नेपालमा यहाँहरू आउनुभएको छ। फेरि पनि एउटा कार्यक्रम उहाँहरूले आएर किडनीको बारेमा, मुटुको बारेमा के हो भनेर हामीलाई यहाँ चाहिँ राख्नुभएको छ। म त्यसको लागि धन्यवाद दिन चाहन्छु। म त अतिथिहरूलाई उहाँ भ्रमणमा आएको बेलामा उहाँहरूलाई अरू खालको सत्कार गर्नु पर्थ्यो जस्तो लाग्छ मलाई। नेपालको कला संस्कृतिहरू यो पनि हाम्रो लागि त महत्त्वपूर्ण हो, तर उहाँहरूलाई पनि यहाँ आएर पनि फेरि त्यही काम गर्न लाउँदाखेरि खै मलाई थाहा छैन यो आयोजक गर्ने कसरी सोचेको राम्रै होला भन्ने मलाई लाग्छ। फेरि पनि हामीले जे कुराहरू यहाँ अहिले सुन्न पायौँ त्यसको लागि म उहाँहरूप्रति आभार व्यक्त गर्न चाहन्छु र नेपालमा यहाँलाई स्वागत गर्न चाहन्छु। नेपालको बसाइ यहाँको राम्रो होस्, सुखमय होस् भनेर कामना पनि गर्न चाहन्छु। र यो जुन कार्यक्रम यहाँ अब अनिश साईजीले मलाई पनि आमन्त्रण गर्नुभयो, उहाँहरूसँग एउटा परिचय हुने मलाई एउटा मौका दिनुभयो, त्यसको लागि म धन्यवाद दिन चाहन्छु। हाम्रो अब हामी अतिथि देवो भव भन्ने देशका मान्छेहरू, त्यस कारण यहाँहरूलाई हार्दिक स्वागत अभिवादन म गर्न चाहन्छु। र नेपालमा जति दिन रहनुहुन्छ यहाँहरूले आफ्नो विशेषज्ञताको कुरा त छ। अब यो हस्पिटलको बारेमा सामान्यतया अब सबैलाई जानकारी नभए पनि एउटा कलकत्ताको एउटा अत्यन्त महत्त्वपूर्ण एउटा हस्पिटल हो, त्यसको बारेमा जीवनजीले भनि पनि सक्नुभएको छ। त्यतातिर पनि म नजाउँ, फेरि पनि यहाँहरूलाई स्वागत गर्दै यहाँहरूप्रति खुसी व्यक्त गर्दै साईजीलाई पनि धन्यवाद दिँदै मेरो भनाइ गर्छु। धन्यवाद।
Sharmaji, Member of Parliament, all the dignitaries of the dais, ladies and gentlemen, it's a great privilege and honor to be here on behalf of AMRI Hospital. We have come here today just to share the views of the Nepal. I mean, we have a lot of objectives to come here. We had a lot of plan how we can better support Nepalese citizen in terms of when they look for better healthcare. AMRI Hospital is a large group of hospitals. We have 4 hospitals in Eastern India and 3 hospitals in Kolkata only. We have 1200 beds all the complex surgeries, all the specialties, as Dr. Majumder and Dr. Mukherjee, they were mentioning about kidney care and your cardiac surgery. We have all the specialty, the multi-speciality hospital we are, and we treat almost 4.5 lakh patients a year. We do almost 50,000 surgeries in a year as well. This is the AMRI hospital. Plenty number of patients from Nepal goes to our place. 1,000 patients we treat in Kolkata, Nepalese patient. One of our major specialty is kidney transplant. There we get hundreds of patients of the kidney transplant patient. हमारे यहाँ का आने का जो objective जो है, जो how we can better support. हमारा plan है tomorrow to discuss few issues in Star Health that with Mr. Bhandari. If we can establish here one teleconsultation support system where Nepalese patient every time should not travel to Kolkata or other places. They can do the consultation, they can consult doctors here sitting in Nepal, sitting anywhere in the Nepal, and any time they require for treatment, they can go to Kolkata or any other place. So that is our intention, the how best way we can support, and that is the whole objective of coming to Nepal. Anytime Nepal is welcome to Kolkata, welcome to AMRI hospital. We have a nice setup. The major advantage in our place, you will feel absolutely homely. If you need any kind of medical support, all other than the medical part, because there is a need of, maybe you need guest house, you need local convents, you need lot of support is required. All the support systems will work for you. The whole team we have, very homely team, very efficient team we have. Any kind of special care is required, AMRI hospital always at your side. Thank you so much. Take care and be healthy. Thank you. Also, please join for dinner, each and every one, all the delegates, ladies and gentlemen. We extend our invitation to join for dinner. Thank you so much.
Just before closing, I would like to thank Anish Shai. I am very happy and I am very proud of him. He also, he developed kidney failure, but he came to us and with the kidney transplant, 2 years old. 2 years old, and he's back to work and normal. And I feel so proud that he has organized this, and we are very grateful to him. So now I have to thank for